You may recall the U.S. Preventive Services Task Force released new breast cancer guidelines recommending that women could delay screening until age 50 and then only have it every other year. Despite many doctors and health experts' concerns, the task force announced this week they are sticking to those guidelines. Here to talk more about this are the Rose co-founder Dorothy Gibbons and Dr. Mahdieh Parizi. Thank you both for being here. An important conversation we're about to have. I have to tell you, as a medical reporter, I have not found one doctor nor one patient who agrees with this. I would love your take on it as a physician.
Absolutely. The breast experts, the doctors who diagnose breast cancer and who treat breast cancer, unanimously state that breast cancer screening mammography for the average risk woman should start at the age of 40, and it should be every year. The established research has demonstrated without a doubt that screening mammography saves lives. Starting in the early 90s, we started to see a decrease in the number of breast cancer deaths, and that's because women were starting to get their mammograms starting at the age of 40. So with the task force's recommendations, we're going to see thousands of women die from breast cancer, and unfortunately millions of women will lose health insurance coverage for those needed screening mammograms.
Dorothy, I see you shaking your head yes.
Oh, absolutely. This is outrageous, and what women need to realize is after this 2-year moratorium that has been put into place by the Congress, they won't have coverage of insurance if they're in their 40s. So right now they need to go ahead and have that mammogram, and they need to start talking to their member of Congress about how important it is to get this extended, this moratorium extended, so that we can hopefully have other studies be reviewed and have these recommendations reconsidered.
Okay, so the deal is right now insurance will still pay. So go get it done. In 2 years it will no longer pay. So you would have to pay. How much would a mammogram cost somebody if it's out of pocket?
It could be anywhere from $150 to $300. I mean, and the whole thing is right now it is covered 100%. No copay, no applying to your deductible. It is one of the preventative services that is covered 100%.
And that's what you do at the Rose. You try to save lives, so I know this is going to be frustrating for you. What all do you do at the Rose, just for people who don't know?
You know, we do everything from that first mammogram to the ultrasounds to the biopsies, but most importantly, we're about access to care. And so we look at our own numbers. After 30 years of doing mammograms, we're looking at our own numbers, and every year, half of the women that we diagnose are under the age of 50. Of the 350 women that we diagnose, half of them are under the age of 50. So how could we possibly think that there's anything good about these recommendations?
So what's going to happen if they wait until 50? Or do they even have, their chances of survival are going to go way down, aren't they?
Absolutely, absolutely. Last year there were 200,000 in 2015, 200,000 cases of breast cancer that were diagnosed. 40,000 women died of breast cancer, and 18% of those 40,000 that died of breast cancer were women in their 40s. So with these new guidelines, what we're going to see is many more women die of breast cancer, and we're going to start seeing cancers that present at a much later stage, larger cancers that are harder to treat, more expensive to treat. So all around terrible recommendations that are not backed by science, or the Society of Breast Imaging and the American College of Radiology do not support these recommendations.
All right, Dr. Parizi, Dorothy, thank you for coming in.
Thank you.
It's important for people to know you were here so that they will reach out, talk to the congressman, be a voice for women.
Yes,
All
thank
right.
you.
Thank you, Jose.